here. Okay, the recording has started. So, welcome everyone. Thank you so much for coming here to our CAMHS Rise showcase. We're really excited to tell you about this fantastic project that's been happening for the last, trying to remember, 10 months. Nick will be able to give you the exact timescales. We're going to be talking, the team who've been working on CAMHS Rise are going to be presenting for probably just under an hour, and then we've timetabled 30 minutes for Q&A. We'd be grateful if you could stay muted during the presentation, but then when we get to the Q&A, you're very welcome to unmute and ask questions direct. If you have any questions during the presentation, please feel free to put them into the chat, and then we'll be monitoring those and we can respond to them at the end in the Q&A session as well. I think that's all I need to say by means of introduction. So, sorry, my name is Dr. Lisa Thorne. I'm a clinical psychologist and I work in CAMHS, and I'm co-chair of our CRAE board, which is the CAMHS Research Audit and Evaluation Board. And I'm going to tell you a little bit about how it all began, where the ideas for this project came from. So in Devon CAMHS, we have children and young people's participation really embedded within our service, and children and young people are involved in our recruitment, in our service developments, and there's pre-COVID there were several groups that met together face to face on a regular basis, and I think Robin, our participation worker, is here. And it was in one of those groups that a young person asked a question and was curious about whether waiting longer for CAMHS meant that you spend longer in the service. And we realised that we didn't really have a means for answering this question. And then eventually that question came to our CRAE board, and we engaged with some trainee clinical psychologists who were able to do a follow-up literature review after working with our library colleagues, and developed a service evaluation proposal. Now, those trainee clinical psychologists didn't have capacity to complete that evaluation, so it was then a few months later, when some other clinical psychologist trainees came to our service, that they were able to pick up that evaluation work and look at our local data and find out the answer to that question. And this sparked thoughts for us, and Nick Walker in a moment is going to tell you what happened next, as we realised that we had a bit of an unwieldy process going on, and it was actually really hard to be quick and responsive to the questions that children and young people have about our services and how we're managing on various levels. So over to you, Nick.
Thanks very much. Thanks, Lisa. So I'm Nick Walker. I'm Research Clinical Practice Lead at DPT. And so somebody's unmuted and I can hear you chatting. Would it be okay to mute, please? Thank you. I'm sort of here to tell you a little bit of the background to this project. So as Lisa said, we have a CRAE board, so Research, Audit and Evaluation, and I attend that meeting on behalf of the research team in Devon Partnership Trust. And currently in DPT, there isn't really any service that sort of supports service evaluation. So the research and development, we do support portfolio research studies, and non-portfolio studies come through our governance service, but we don't support service evaluation. And our quality improvement team do lots of quality improvement work. But again, service evaluation is not something that there is a central team that can advise people about how to conduct it. It very much sits within clinical teams. Now, to me, I think service evaluation is like the little grain of sand, and that top picture is a grain of sand that leads us to create the pearls of research and, come up with really strong evidence-based interventions. It's all about being inquisitive. A lot of people come to us with ideas for research, and actually at that point in time, it's really a service evaluation, but we can get a bit lost in it. And there's not a lot of support there. So that's why I'm quite passionate for us to think about service evaluation. But also, I think as the CRAE team, what we really liked about a young person coming to us with an idea is, the questions that we might ask as clinicians in a service or as trainees may not be the ones that are really, really important to people that use our services. So within research, we are lucky enough to be able to sort of request various innovation funding bids. Could you move to the next slide, Becky, please? And early last year, sort of April, May time, I was informed about an opportunity to put in an innovation funding bid to the Clinical Research Network for up to £10,000. Could you click on? Thank you. So there's the sort of specifications for the bids is about looking at ways that we can develop continuous service improvement, that we can think about people that use our services participation, so patient participation and involvement, PPI, to think as well about how we can kind of promote research and improve people's awareness of research, and also to think about workforce development. And I really felt in talking with Lisa that we would be able to put in a bid to support this project, which became the CAMHS project. That's what it wasn't called that at the beginning. So we did submit our application, and we were very lucky that we were given the funding bid to sort of work on CAMHS Rise. What that meant was we've got Becky, who's worked 1 day a week with us, and it was I think it was summer last year that we were informed that we were successful in our bid. So Becky was able to come into post, and we sort of developed the project, which she'll go on and explain about in a minute. So the reason that we felt that this project would be a good one to promote continuous improvement is that if we talk to young people who use our services about what's important to them, then when we are being approached about different research studies, if we know what's really the burning questions for our young people, then we can be more selective about the research studies that we choose to do in service. Because anyone who work, we working in the NHS clinical services and in research, we're all so busy, and it's really important that we are sort of selective about activities that we undertake. So that's been great, and we do think that that's a service improvement to think about the voices of those young people. We were also really passionate about finding ways that young people can generate ideas that we can then take on and share with people that then can undertake those sorts of service evaluations, and us to be able to create a system for that. We were also, it gave us an opportunity to work collaboratively with CHIME, and that is the group at the University of Exeter that work on young people's mental health research. And we thought as well, by having this project and having time to kind of develop it in a way that's really well structured, we could pull the processes that are used by, for example, the James Lind Alliance, where you ask people questions and then you have a big repository of questions. You then have the same stakeholders that can look and prioritize the questions so that you come up with the top 10. So we thought that would be a really innovative way to work, well, a good way to work, which is tried and tested. Regarding PPI, so patient participation involvement, it was a real opportunity for us to use the participatory groups that already exist within CAMHS to get young people's involvement, to sort of hear their voice, find out what are burning questions for them, and then also to look at parents and carers. And we had hoped to be able to involve staff in the first sort of wave of this to see what's important to them. Do they align, or are the burning questions different for parents and carers and perhaps staff? There's a big drive it within the National Institute for Health Research to ensure that we hear the voices of underserved groups. So one of the things that within this project we wanted to include was trying to work with cared for young people and attend those groups as well. And we wanted to give young people that did get involved an opportunity to carry on with their involvements, perhaps in either the service evaluation or to be signposted to the clinical research networks, PPI groups, and also that CHIME have a PPI group, so where they can involve young people in developing research. So it was a sort of a way to gently introduce young people to the world of research. So that moves me on to increasing research awareness. Part of this project that Gretchen's going to talk about is some evidence summaries that's part of this project, that we ask these questions and we look at what evidence is already there. And to be able to provide young people and parents and carers with easy to read, quick summaries of what's out there already that's kind of related to their question, we thought again would be a really good way to go, you've got this idea, you've got this question, and this is how it all starts. And hopefully we've kind of decoded the technical stuff and made it a bit more palatable, and hopefully kind of, like I say, sparked people's interest. We've also, in getting a sort of repository of questions, we're able to say to young people, well, actually, some people come and ask us, what do they, what do we think that young people are interested in from research topics? And we can let people know the general themes that seem to be really, really high on the list. So again, how we generate these questions are inquisitive, and then how it can then feed into research. And they're there right at the beginning. And regarding workforce development, the big drive within the NIHR is about early career researchers. So that can be clinicians that have an interest in research, they have burning questions, and that we can help guide them through a process where they can then start to apply for fellowships or funding to support a question that they have to actually become the researchers of the future. And we felt with this project, actually asking service evaluation questions, bringing in research, will help our staff also see what the process is, and then we can, if there's interest sparked, we can again guide them to funding opportunities which can lead on to that part of their career. And actually also for young people, they are, hopefully a lot of them will be healthcare staff of the future, so for them to have a sort of a slight understanding of how asking a question can lead on to research, maybe that's something that they'll think of doing in their career. So that's kind of what we put in the bid, and as I say, we were very, very lucky to be accepted for funding. So I'm now going to move over, sort of pass you on to Becky, who's going to talk about what the actual project development was, and give you a bit of an insight into the process that we went through.
Great, thanks, Nick. So as has already been said, I'm Becky. I was working on this project 1 day a week as a research assistant. For the other 4 days, I'm an assistant psychologist for an adult diagnostic autism service. But my background is CAMHS inpatient, and I still pick up bank shifts on a tier 4 psychiatric unit because I love CAMHS, and so I was so excited to be offered the opportunity to be part of this project. So I'm going to give a quick project overview over the last year, I guess, before getting into some of the details of how we got into this. So phase 1 from summer last year. This involved gathering questions from young people. So we ran 3 workshops, and we also had an online form where young people could submit ideas anonymously. Then we got into the prioritization. This is where young people ranked the questions from the first workshop, and Gretchen will talk more about that later. Then here was the review. So the top 5 questions had evidence summaries completed about them, as Nick has already mentioned. And then young people had a choice to stay updated on project progress, and the evidence summaries began to get finalised. And it was at this point, after the first 6 months, that we were given more funding from PennARC, and that allowed us to extend the project for another 6 months, which has just been it's been fantastic. And so we entered into phase 2 of the project. So the first bit of that was evaluating. We wanted to identify the missing voices from phase 1 of the project. And we also wanted to see which questions could be answered right away without need for service evaluation, so people could get quick answers rather than having to wait for the long research process. So the next stage was filling in gaps in questions from phase 1, and also get feedback via focus groups about what we had done so far and possible looking to the future. Now, the prioritization phase, we are still in this at the moment. So this involves asking CAMHS experienced young people to finalise and prioritise our final list of questions. We have 106 for them to go through, and then we're going to compare this to the views of parent carers, because we also did a little prioritisation with them. And then the final phase will be sharing, we'll be disseminating the information. So the final list of questions, including the rankings, they'll be placed into a repository for trainees and researchers to access, as already mentioned, and we will be disseminating our findings, which we will explain more about later. So that was a whistle-stop tour of CAMHS Rise so far, the first 12 months. So how did we start it? We began with developing our resources. So we wanted guidance from people on how to run the workshops, really. So we met with stakeholders. So this was CAMHS participation leads, people affiliated with Young Devon County Council, and also young people, because at the end of the day, this is what this is all about. And we had questions like, would it be better to dip into groups that already exist? Should we set up external sessions so that people could come if they want to? Is this going to be face-to-face? Is this going to be online? Because all of this creation was against the backdrop of pandemic confusion. Are people wearing masks? Are we not? The rules were always changing. So from the off, it was quite a dynamic project. So once we had got some ideas together, we thought about what we might like the content of the workshops to include and a rough structure. And so we went and we did a focus group with the Young Devon Wellbeing Cafe, which was face-to-face. They were wonderful. We had 8 participants. We had some amazing feedback, you know, massive bits of paper all over the floor, people scribbling ideas, and genuinely their feedback was absolutely invaluable. It was fantastic. It was great getting in there and talking to these young people. And from that, we adapted our ideas, we honed them, and it was starting to get time to finalise the workshops and get out there and talk to people and gather some data. So the workshops themselves, we came up with this rough outline. So introduction, obviously, icebreakers, because everyone loves icebreakers. Part of our focus group was discussing the different kinds of cheesy icebreakers that we could have. Then we wanted to talk a bit about what is research, explain the purpose of mental health research with children and young people, talk about the research cycle, and highlight the length of the process and where CAMHS Rise project would sit in that, because as we know, it's lengthy. And we also had examples of ways that research has directly impacted upon services to give it a real world grounding. Then we wanted to give a basic outline of the project and highlighting where that particular workshop, that particular group sat within that. And then this was the meaty part, the participant discussion around experiences of services, what went well, what could be improved. We made it very clear that people did not have to share experiences if they didn't want to, or they could do this anonymously. But we thought that it would be really, that's what we wanted to hear, and what would be really important as a way of generating these conversations. And then we finished up. There was time for questions from participants, outline the next steps, and all of our participants got a £20 thank you voucher. And also we had a link to the anonymous online submission form that I said about earlier, because some young people, we thought they might have lots of ideas, but we all get a bit shy sometimes, or there might be things that they wouldn't necessarily want to share in the moment. And just to share, this was our icebreaker. This was designed by one of our young people from our first focus group. Which blob do you feel like today? Absolutely fantastic. So grateful that we were allowed to use it. Gretchen and I, before each workshop, would spend about 5 minutes like, what blob are we today? And we'd always go first to give people a little time. But that was a great conversation starter. So yes, thank you again in particular to that young person who allowed us to use this. So we had an idea of how we wanted to run the workshops, but in reality we kind of stuck to that, but every single one was so different. We ran 4 in total, 3 in phase 1 and 1 in phase 2. So the first one, we went back to the Young Devon Wellbeing Cafe. This was via Zoom, and we had 6 participants. This was very much young person led. We just kind of sat in the background. There was a young person making notes on the interactive whiteboard that we could all chip in with. And then after that board was filled, then we went back and looked at certain points, clarified them, maybe extrapolated a few different questions from one idea that had been raised. Our next one was with the Devon CAMHS participation group. So this was via Teams, and we had 2 participants. This was more of a space where the participants could tell their story. I guess it was more lengthy and more in depth for that particular young person. Then we took notes, and then we reflected back what we felt that we were hearing, and had a conversation about that to make sure that we were on the right lines. And again, both of these groups, different levels of participants, so much rich data came out of that in different ways. So the next, we went to Torbay, and we met with a group of care experienced young people. This was face to face, and we had 9 participants. So this one, immediately we realised that our approach was not going to work that we had used before. So we completely ditched the slides, sat on the floor. It was a really raw, organic conversation, multiple conversations going on at once. This was probably the most highly energized, and I say chaotic, of the groups, but there were so many incredible points coming up. Everyone was considerate of each other's feelings. And yeah, we got a lot of great stuff from this group. Again, so different to the other ones that we had done before. And then our final workshop was our parent carer group. So this was in phase 2, because we had identified that this was one of the voices that we hadn't heard and we thought would be really relevant. This was via Zoom, and we had 11 participants. So initially, this was just, we were hoping to do a little prioritization and also maybe fill in some gaps. We weren't expecting that many questions to be generated, but they were. And they were all, again, there were different topics coming up, and we'll talk later about the differences between the workshops, but this really highlighted it, and highlighted the benefits of having multiple groups and hearing multiple voices, and having them alongside a pre-existing PPI group. I mean, there's challenges and positives for sure. So after we had gathered all of the questions, it was time for prioritization. And this is, I'm going to hand over to Gretchen, and she is going to explain a bit more about that process. Thank you.
Hi, I'm Gretchen. I'm a researcher at the University of Exeter in the CHIME research group and in PennArc. So as Becky said, after the workshops, we wanted to go back to young people to ask them to tell us which questions were most important to them so that we could prioritize our list. We've run this prioritization iteratively, partly because we had the phase 1 and phase 2 of the project, but also so that we could be producing evidence summaries for the top ranking questions kind of as we went. So we're broadly following the example from the James Lind Alliance for prioritizing research questions. So after the first workshop, we wanted to kind of get started on this so we could get some evidence summaries coming through. At that point, we had 30 questions already. So we asked young people to have a look at that list and choose their top 10. Which seemed to work quite well. We set up an online survey to do that. So we had an online survey where they could just select their top 10. And actually most of the responses to that came from our third workshop with care experienced young people. At the end of the workshop, we basically just passed phones around with the link open, and they looked at them while they had their tea and selected their top 10. Yeah, and so that kind of gave us a starting point for our first evidence summaries, which I'll talk about in a moment. And then when we met with parent carers, we also wanted to ask them about their thoughts in terms of which questions they felt were most important from their perspective. And at that point, we had 90 questions because we'd run all 3 of our young people's workshops. So we knew that was a lot of questions, so we organized those into themes to try to make it a bit easier, and we gave them a kind of quite a large amount of time in the, during a break in the middle of their workshop to do that, but we still found, probably not that surprisingly actually, that was quite a big ask. That was quite a lot of questions for them to go through. So, you know, in some cases they would just choose their top 1 from each theme. That was fine. That worked also. But you know, it was quite a lot, which they kind of fed back to us. So it did enable us to have a look at what they felt was most important, but it wasn't a perfect system, and we realized we needed to kind of rethink how we're going to manage prioritization with such a long list. So kind of referring back to the James Lind Alliance method for our final prioritization, which is currently ongoing, we have 106 questions now. What we've done is we've split that list into 4 lists. So we have an A, B, C, and D list. Those are randomly allocated questions, and different young people are getting different links to choose their top 10 from one A, B, C, or D. So those lists are being sent out back to our workshop group leads, as well as through CAMHS clinicians to send to their patients to go through and choose their top 10. And that's, yeah, we're kind of having those results coming in and monitoring those 4 lists at the moment. Yeah, so hopefully we will keep having feedback on that from young people, and that will help us to formulate a prioritized list of all of our 106 questions. And then from that prioritization, as I said, we're kind of doing, as we go, we're working on some evidence summaries. So next slide, please, Becky. So one of the things that we felt was really important, as has been mentioned, is that you know, the research cycle, as we all know, takes a really long time, and kind of even doing service evaluations, those are not going to be happening immediately. So we really wanted to think of a way that we could give something back to all of the young people and parents who've given us their time and their thoughts and shared their experiences with us. And also we wanted to have, you know, another kind of interesting output from this project. So we're looking at the top ranked questions, and we're doing kind of rapid evidence summaries of those. So these are not systematic reviews. They're very much a rapid search for evidence, focusing on the highest quality and mostly kind of more recent research around each question, with help from our PennARC evidence synthesis team. So the team at PennARC and CHIME researchers are conducting these summaries. So they're searching for the evidence, and then writing a draft plain language summary of existing evidence, and also mentioning any ongoing studies looking into the question as well, so that young people can hear about what's happening at the moment. And then after a kind of draft is written, we're going back to at least one expert who maybe someone we've identified through our research in writing the summary, or people that we're already aware are working in the area, and just asking them to have a check and see if we've missed anything, or if there are any studies that they know of that we should include, or if we've misrepresented any of the research at all, just to have an expert check of it, really, a peer review. And then once we've revised based on that review, we're going back to young people to ask them to review the summaries as well, to let us know if they are helpful, if they're understandable and clear, if they answer their question. And we're also going to CAMHS clinicians as well to get their feedback and comments on the summaries. So then revising again based on those pieces of feedback. And then those are going to be, then those are reformatted and sometimes reordered. So one thing that we are doing is creating a kind of front page that's a overview, kind of like an abstract, but just really the key points, in case anyone just wants to look at that, and then if they want more information, they can read the more detailed summary. And then we're going to work on disseminating that. So we're obviously really importantly sharing that with all of the young people and parents who've taken part in the study. But we're also planning to put those up on the Devon CAMHS website and sharing those via our networks in Penark and Chime as well. So hopefully you will see those come out. So I think we've got several already, and they're still coming. So really pleased to share those, and they may also be hopefully good things that might inspire future research as well, because they give us a little bit of a summary of what's known at the moment and what might need to be what questions might need to be asked next. And I will pass over to Becky. Oh no, sorry, I'm not passing over to Becky. I'm going to say, sorry. So sorry. Our top questions so far that we've already either produced evidence summaries for, or that we have evidence summaries in the pipeline at the moment. I'll just read them out. Do waiting list times for CAMHS lead to worsening mental health in young people? What strategies are effective for improving young people's experiences of transitions between child and adult mental health services? What can be done to help young people feel more listened to in the CAMHS referral process? Does level of parental support a young person has impact the effectiveness of treatment in CAMHS? What support can be offered to young people while on the waiting list for CAMHS? And how does having a diagnosis of a neurodiverse condition affect CAMHS practitioners' decisions about mental health treatment? I'll just say that final one was actually from our parent group, but all of the others were from young people. Like I said, we're still prioritizing, so we'll have a few more evidence summaries that will come along before the end of this project. Right, and I'll hand over to Rachel next, talk about the extension of the project.
Thank you, Gretchen. Hi, everyone. So I'm Rachel Hayes. I'm a researcher at the University of Exeter, as well as working within Chime, which is the same research collaboration that Gretchen works in. I also do a lot of work within the Southwest, the Peninsula ARC, so the Applied Research Collaboration. And within my role within the ARC, I am co-leading the Mental Health Research Initiative program that we have going. Now, I have noticed that we've brilliantly got a number of people who are not from the Southwest. So apologies for this bit. It's going to be a little bit redundant for you because this is only for the Southwest people. But I wanted to have a moment just to explain why we wanted to support CAMHS Rise, why we felt it was important, and also just to remind those of you in the Southwest that what our aims are. So I know I've spoken to a number of you before, but it's always worthwhile just reminding you that we are here to support actually. So initially, I'm going to talk about the aims, and then I think we'll talk about, because I think it's quite obvious why we continue to support CAMHS. So when Nick and Lisa initially applied for the money, and Gretchen, actually you were involved as well, weren't you? It was for a 6-month project. So the idea is that it would last 6 months, and it did get to that point. And because of our aims of what we're trying to do within the MHRI, which is the Mental Health Research Initiative, we were really, really keen to support that, and we could see the benefit of that. So just briefly talking about what we're actually trying to do within the initiative. So for those of you that aren't familiar, the ARCs are nationwide, and their role really, they're funded by the National Institute for Health Research. And their role is to be that gap between academic research and health services. So as an academic, I'm very aware that we can get stuck in our little ways and sitting in our ivory towers and really missing the point of what's actually going on for people who are living day to day, particularly around mental health issues. So the ARCs are there, not just for mental health, but for any health services, really. They're there to be a friendly face that we, as Gretchen has mentioned, we can run evidence summaries, we can do systematic reviews, we can look at implementation, we have all sorts of experts who are working within that area. So we are funded by the National Institute for Health Research, and about 18 months ago, NIHR put a big call out saying that actually one of the priority areas that they wanted to focus on was mental health, and particularly mental health research that is not traditionally done very well. So the kind of things involving people from disadvantaged backgrounds, involving people from poorer areas, and rather than thinking, okay, so I've got this idea that I want to do, I'm going to go out and I'm going to find a clinician who will play with me and we're going to recruit some people, turning that on its head and saying, let's go and talk to people who are working with in mental health, so people who are working with people who have challenges with their mental health, and ask them what the challenges are, what the issues that they would actually like research to help support them. So very much we have no agenda other than to support the research that's happening, and because we're linked to the Peninsula Arc, it's the research that's happening within the southwest of the country. And underpinning all of that, and it should be underpinning every element of research we're doing, is we have got to have good patient and public involvement. It's absolutely pointless us doing things that are supporting academics' careers or supporting clinicians' careers if they're not actually the things that matter to the people that we are striving to make positive impacts on. So everything that we do within the ARCs, everything we do within our research has that element in there that we need to be making sure we're asking the right questions, because we can get very caught up in, well, we want to reduce, I don't know, inpatient numbers of days. Actually, maybe that's not the issue to people. Maybe it's about feeling like they can cope day to day, and sometimes actually going in hospital is needed or whatever. So, we need to make sure that we fully understand what's happening. So that underpins everything that we've got here. But I just wanted to plug just briefly the fact that within the Southwest, we do have two main strands of the work that we're doing, and we are reaching out to people. If anyone would like to find out more, I'm really, really happy to be contacted and to have an informal conversation with people. But one of our main strands is about what we're calling nurturing people. So building capacity and capability, supporting people who are not academics to understand and use research and to start generating research. We have an associate program which has kicked off, and we've got a variety of different people who are part of that associate program. Some people have got quite a lot of research experience, and we're kind of thinking, well, probably let's do some ethics applications and let's actually do some piloting of the ideas that you've got. Other people are really just starting out, and it's more about, this is what research looks like, and when you read a paper, these are the kind of things to be thinking about. So there's a very wide scope, and if anyone is interested in understanding more about particularly how to use mental health research, then we have spaces that we can help people with that. And then linked to that, but sort of slightly separately, we're interested in doing some primary research ourselves. So we're interested in really targeting those unmet needs. So finding out what the issues are and then really targeting where we can. And mental health is obviously a huge category. It's everybody has mental health. It's very difficult to say, well, that we're talking about this group of people. So it's very wide. So we have focused slightly, but I still feel actually it's quite a wide ask. But the two areas that we're particularly working with are children and young people. And also, just so that you know what the other area is, it's adults who, because of complexity, are kind of falling between the primary and the secondary healthcare gap. They're often people who research is not well served as well. So as an example, we have just started working with a collaborative mental health team within Devon, who really focus and prioritise on working with homeless people and thinking about their mental health needs. And one of the things they say is, well, all of the evidence that we look at, you know, there's lots of great RCTs done on brief interventions for low mood, anxiety, but they're all excluding people who've got comorbid substance abuse as well. And they're saying, well, our population has a very high rate of comorbid substance abuse. So it's that kind of thing, is saying, right, well, what are we doing well at, and what do we need to support a little bit more on? And ultimately, it's so I've kind of gone around that, but it really is to support the research that's happening within the Southwest, thinking about the mental health needs of children and young people and complex adults, and ultimately trying to feed back into the system to enact positive changes. So I think that kind of pretty much explains why, when having a chat with Gretchen, who sits right next door to me, you know, she's talking about this great project she's got and how it's such a shame because it does take time to get these things off and running, and 6 months is really no time at all. It absolutely flies by. It just seemed an absolute no-brainer to us that clearly we want to support this, and so we matched some funding and enabled the project to carry on for an additional 6 months, because it really does exemplify everything that within the ARC we think is important about how we do research and how we involve people in meaningful ways. And I think the last thing I would say is the thing that I like the most about what we're doing. Well, there's two things. I like the prioritization. I think that's a lovely way of getting young people involved and thinking, yep, you've got lots and lots of ideas, but clearly we can't look at 106 ideas. But saying, okay, so given that, which ones should we look at first? I think that's been really well done. And the second part is the evidence summaries. I think that is something that as researchers, we often forget about, really. So we ask people what they want, we ask them what their questions are, and then we busily go off and do things. And then a couple of years later, a paper might be published. And I think the idea of giving something back initially, which, we're talking 4 or 5 pages with a summary page at the front, so it's very short, but it's that actually we've gone and looked, and your question was really interesting, and it's so interesting, lots of other people have done it, and here's what they found, or it's really interesting, but actually nobody's looked at that yet, so we'll have a look at that, hopefully. So yeah, I think that's all I had to say. So I've absolutely forgotten who I'm handing back to, but I will now hand it back.
Over to me. Thank you, Rachel.
Okay.
And thank you for continuing the project. It has been great, and we definitely needed that extra time. So I'm going to talk a little bit now about what's next. So obviously we've done this project, and I think we all feel really passionately about it, but also I think one of the things that's important to do is if you're given some money to do an innovation project, it's really important that we disseminate what we're doing. So I'm going to talk a bit about dissemination. This is in a couple of areas. So we've done this project, we've got this repository of questions, we're doing some evidence summaries, but actually the main sort of body of the questions, what we aim to do with that is disseminate those questions by us looking through, seeing which questions are service evaluation questions, which ones are really research questions. And with our service evaluation questions, we have an opportunity to invite our clinical trainees. So these are people who are doing their DClin, so their doctorate in clinical psychology. They come and sit within services, and as part of their training, they need to do a service evaluation. And those questions are normally generated by themselves or by their supervisors. And what we want to do is we want to say, these are the service evaluation questions that are really important to our young people. So we're looking to disseminate these to the universities within the Southwest to say, we would like the trainees to consider looking at one of these topics that are important to our young people. So that's one way that we're going to do it. We also wanted to showcase what we've done, and this event is our showcase. And what we'd really like to do after this, if people are interested, Becky has done a load of work on really mapping out the whole project and all of the steps. So we've talked very briefly about it, but she's putting together a bit of a document about what we did, lessons learned. So we'd really like to share that with anybody that thinks that they might like to do it within their area. I certainly don't think that this is a CAMHS project. This could be a project in any clinical service about sort of utilising participation groups that are already there. So we haven't set up any separate groups. We've gone into groups that already exist. So we're sort of invited in as guests, and I think that that's been really important. You definitely do reach a different group of people that don't really know about research. So yeah, we'd love to share the process with you. And we're also hoping, we've looked at our budget, we've got a little bit more time actually. So Becky's kindly agreed to stay on until the end of the year, and we're hoping to write some papers for publication, maybe editorials, but hopefully we'll be able to publish something in a peer-reviewed journal. But that's what we would like to do. So I think, you know, that's the bit about dissemination. I'm going to move over to Lisa's going to talk a bit about sustainability.
Thanks, Nick. Yeah, so we're obviously really keen when Becky's role finishes and we don't have this external funding that we've been so fortunate to have in order to develop this project, that this becomes really embedded within CAMHS, that we don't lose it. So the plan is that a couple of our assistant psychologists will be able to pick up owning and holding that repository of questions. As Nick said, Becky's developing a pack, so it'll be very easy to, we hope, for any of you who are interested to replicate, but also there'll be a really clear how-to guide for our assistant psychologists who could take over managing the project with support from some of the clinical psychology staff group. And our expectation, given that we already have over 100 questions, is that initially what we might be doing is going back and reprioritising some of those questions with existing groups or other groups of children and young people that we have connections with. We'd really like to reach out to some of the groups of children and young people who we know we haven't been able to reach in this project. So particularly thinking about younger children, sort of primary school age, and probably that sort of year 7, year 8 as well. I think most of the groups that Becky and Gretchen were able to meet were sort of in that sort of teenage upwards age range. So it'd be really interesting to learn whether younger children have got different priorities and different questions. And obviously it would be great to sort of widen our conversations with parents and carers as well. So we'll be looking at maybe running 1 or 2 workshops a year and doing that prioritisation exercise. I think we're also really keen to maintain on these flourishing relationships with Chime and PennArc and see how we can sort of maximise on future collaborations in terms of research developments. We haven't quite worked out the sustainability bit around the evidence summaries. That was something I was just thinking about as Gretchen was speaking, actually, was would we have the capacity within our workforce to potentially do that? And that's something that's got to go on my list, I think, for discussion, because I think that's something that's been really fantastic. Being able to give that relatively quick response to the young people who raise those questions and to be able to answer whether there has been any research already looking into that, or whether it really is something that people haven't thought about thus far. So yeah, I want to have a little think about that, about how do we keep that aspect of the project going, because I think that's an important part of the sustainability package. And Nick, I think you're going to talk about how the evaluation of the project.
Yeah, thank you. So part of the innovation, funding bid was I did have to put in there about how we're going to evaluate the project. As it's sort of extended, it's going to be a little bit harder to do. But what we hope to look at is, how many of our clinical psychologists support the questions that are on the repository. We'll be looking at how many of those are taken up by the clinical trainees and the outcomes of those, and just to see how long it takes them and whether it really is sort of, fit for purpose as it stands. And I think also we will really look at promoting opportunities in PennArc for further funding, and we'll see if we can get feedback from the Clinical Research Network about people that are applying for sort of research associate the Research Associate Scheme or small grants. And I think, you know, as evaluating that sustainability, are we able to keep this going? Are people that use our services interested in taking part in this? Do they want to be involved in feedback? So those are our plans. How easy that will be, I don't know, but we really do hope that we do see, you know, over the next few years, this be the gift that carries on giving, really. So it'll be a bit of a watch this space. So moving on to our next slide, we would really like this sort of last half an hour to be able to kind of talk with you about the project, but maybe answer some questions that you might have. So I don't know, Lisa, are there any questions so far that have been generated?
Beth has literally just put one up. Beth, I don't know whether you want to ask it in person, or are you happy to do that, or would you like me to read it out? Beth hasn't appeared. So the question was, might we be able to utilise medical students who could be on a research study unit? They might be able to support with the evidence summaries. So I guess it's an idea rather than a question, but that's a really great idea, isn't it?
Yeah, I do think that that's a really good idea, and I think that that's, I mean, I guess at the beginning of this talk, we didn't, I mean, Lisa touched on it, that what's really apparent is, you know, clinical services are really, really busy, and it's really hard to be able to know who can do these important bits of inquiry, shall we say. And actually that's where we thought that because part of their role as trainees, that our DCLIN trainees need to do service evaluation, that this is how we can make sure that there is a group of people that have that protected time. So actually, I think you're absolutely right. If there are other students that have protected time to do this service evaluation, I mean, it's good for them, isn't it? We have a health librarian within DPT, Mary Smith, who's been, you know, helped us. Well, certainly when I was, you know, putting in the bid, but she, you know, that there are those people that are available to help, and as Rachel says, sort of PenArc can support that. But yeah, for medical students, I think it'd be great.
We've also got a question in the chat from Sophie asking, I think this is to everybody, what's the main piece of learning that's come from engaging so richly with service users and young people with lived experience that could be applied more generally to research and clinical work? Wow, that's a big question.
Becky, do you want to? I don't mean to put you on the spot, Becky, but
I mean, I've just been overwhelmed this whole time with the richness of the stories that have come from these young people with lived experiences, our parent carers. It has been overwhelming. I mean, the emotions that have come out of these groups, there has been a lot of anger, there have been tears. So that's something that people going forward in future should be mindful of, because it can unintentionally be quite a therapeutic space, but just the questions that were coming up and the ideas that were coming up, some things that are coming up, you're like, oh, well, we thought that this was quite clear, but obviously it isn't. And I think that's really important. As we were going through the list of questions, you know, Lisa was able to say, well, I can answer that straight away, answer that straight away, answer that straight away. So with those questions, we're going to make like an FAQ kind of info sheet that's going to go up on the website for people to see. I think it's so people feel unheard as well. That was one of the things that came out of this, and just, I guess, the potential disparity between people coming up with ideas and how that actually relates to service users. And it's just been fantastic, and I think even just having that space to be heard, and then having the quick responses. I know everyone's talked about the evidence summaries, but having something straight away to be able to say, look, we are listening to you and this is what is already out there. Because otherwise we heard people who were disillusioned with research. They'd given their feelings about things before and then felt that they hadn't been listened to, which is not what we want. That's not what services want. That's not what clinicians want. But yeah, I think that as Lisa said, this could be replicated in any service. I'm already thinking about my service that I'm working in and how important that would be for potentially autistic clients, people with learning disabilities, older adults. There are so many ways that this could be replicated. Everyone's voices deserve to be heard, and this is, it's just got me fired up. I'm buzzing to be part of this, to be honest, and I'm so excited to see what it looks like in the future. I don't know if that really answered the question. Does anyone else want to add anything? I get a bit, yeah.
I think one of the things that I would think about is as a clinician, you know, we fundamentally engage in evidence-based practice. So I think it's good for us to be reminded that people may have questions that they ask of us, and actually a good thing for us to do is go and look at the evidence. We can do a quick search. We can do it on Google Scholar. You know, if somebody's saying, I'm really worried that I'm having to wait such a long time. I mean, waiting list times was a really, asked a question time and time again. But sort of us going, well, does it? And, really, it's a good opportunity for us to keep exercising that muscle of going, that's a good question. This is what I'm going to do. I'm going to go and look at the guidance. What do NICE say? Has Cochrane done a review? I can just look at Google Scholar and just keep reading that sort of, those sorts of publications keeps us just remembering what we need to do when faced with questions and doubt, really. So I think that's my takeaway from it.
I'd just add one further thing as well about how important and doable it is to really do outreaching with people that you wouldn't normally think of. When people say, what do you mean you're going to ask young people, children, you're going to ask them what their research priorities are? They're like, well, how are they going to understand that? But you do it well, you do it in the way that Gretchen and Becky did it. And yes, they can understand what we mean by research. Obviously, we don't sit in the room with them and say, what are your research priorities? But when you phrase it in the right way and you actually make the effort to explain it in easy to understand ways, or ways in which they can understand it, then yeah, they absolutely do understand what research is, and they have really valuable contributions to make.
I think the other thing I would, I'm completely with you on all that you said. Just going back to Becky, your comment about some of the questions being things we could answer. For me as a clinical leader in CAMHS, that really highlighted the importance of talking to children and young people about how we communicate and where we communicate. And whilst I could say, I know the answer to that, it was very enlightening to realise that young people didn't know where to find that information. And perhaps, it's made us think about adjusting our comms, I think, for children and young people to make sure that information is readily available. So we have a couple of other questions. One was about the evidence summaries and whether young people felt satisfied with the answers. I know, Becky, you have shared some of them, and obviously not all of them are complete yet. Have you had any feedback?
No, haven't had any feedback about the ones that we've sent out so far. But when Gretchen, because you made some edits, didn't you, to when we disseminated them for the young person reviews?
Yeah, so when we go back to young people to ask them for their feedback, we kind of frame that feedback around questions, around specific questions. So I can't remember exactly how we word it, but it's something like, do you feel that this is answering the question? Do you find this information helpful? Who else might find this helpful? How can we share it? I think it's those. And is there any anything that you don't understand? Anything that isn't clear? It's those kinds of questions. And the feedback's been really positive. I think what they've written in their feedback in terms of answering those questions is it's been really really positive, but also they've provided some really helpful feedback in terms of making it clear, making it better. But yeah, we've only just recently started actually disseminating the summaries back to the groups, so I'm really hoping that we do get some feedback on those, especially from the young people, from the groups that actually ask the questions. So I'm hoping that they will tell. Hopefully they will find them helpful, but I would also really be grateful for any other feedback, and if they're not helpful, if there are ways we can make them better. So yeah, so definitely we're listening out for that.
Can I just mention on that point, just I sort of want to use this opportunity to sort of publicly thank Gretchen and Becky for all of their hard work, because all of the branding that has been developed. So CAMHS RISE is an acronym that was developed with young people. The logos, Becky's worked really hard on the way that we present the evidence summaries, and young people have been involved in every step of that. So I do think that that's also massively helped to make it more accessible. And actually, it's in a format that young people would like it to be in. And I think that that's been a real strength in the study, and I think that they've invested a lot of time in that, which has been amazing. And I hold my hand up. I definitely, if I'd have been, I would not have done nearly as good a job as Becky and Gretchen on this. They've been so creative, and the young people have been so creative. It's been really wonderful. And again, another sort of real strength, I think, in the project. And maybe some of the things that delayed it slightly in getting down to, and why we really needed that extension was there was groundwork about it being right and looking right. So I think that's been great and really important.
That links really beautifully, I think, to the next question, which was about advice on how to facilitate or elicit young people's feedback in a way that captures their views, but also can be operationalized into a research question. And I was thinking about how important that the preparation is, and the development, and ensuring that I don't know, it almost feels like young people helped you develop those ideas, Becky and Gretchen, but you can probably talk to that more. But I think you've been so participatory the whole way through that you've learned as you've been going and developed as you've been going based on that feedback, and that's what's facilitated young people then being honest with you about their thoughts and their questions. But it's also that bit about how that gets turned into a research question, which maybe you could talk about, because I know you spent quite a lot of time thinking about that.
To take that, yeah. So yeah, that's true. I think when we initially were in our very earliest ideas around how the workshops would go, we thought we'll ask for ideas and experience, and then we'll actually work with them in the workshop to kind of rephrase their ideas into research questions, kind of PICO research questions. But we before, as we kind of thought it through and in our earlier kind of revisions to workshops, we realized that just wouldn't. We don't want to go into these workshops critiquing their questions or their ideas. We wanted to just listen and take them down. So what we instead did was more of just a reflective listening kind of. They would share their ideas, their experiences, their ideas, and we'd say, we just reflect back to make sure that we understood what they were saying, rather than necessarily turning them into research questions in the actual workshops themselves. We just wanted to make sure we kind of got the main points that they were trying to make, so that just check our own understanding. And then it was after the workshops that we went through our notes and rephrased them into research questions. But then the idea is that part of the reason, well, one of the effects, I guess, of the prioritization exercise is that then the young people can tell us if the questions, once they've been rephrased as research questions, are still important to them by prioritizing them or not prioritizing them. So yeah, so that was sort of the process. And I guess we always started the workshops by introducing kind of what research is and some examples of what research looks like, to kind of get them in that mindset. But really it was just about listening to their experiences and checking our understanding and taking excellent notes, or sometimes they took their own notes for us. Yeah.
And I think the reason that we've got 106 questions is the themes, you know, there's overarching themes, but there are lots of different nuanced questions, ones that could be a PICO question for research and others that are very sort of specific, same topic, but very specific to services as they're being delivered at the moment, which are, you know, definitely more applicable to service evaluation. And again, I think Becky and Gretchen have worked really hard to ensure that those nuances are reflected in the repository that we have.
I think as well, it was key for us going in that every group that we went to, there was a group leader, so there was someone facilitating, and that helped us, and in communicating with them gave us an idea of what would be best for the young people that we were talking to. And very quickly you get a feel in the room, whether it's face to face or online, the best way of communicating, of gathering information, and just listening. Again, it sounds so simple, but I think that there was a feeling of quite a lot of our young people of being talked at, maybe in different situations, and you know, this was a space where people could be listened to. And then yes, we adapted it and changed some of the questions. They were already coming up with all of this terminology, and we were like, oh, we don't have to change this at all, thanks guys. And I must admit, that's definitely more Gretchen's remit. Gretchen was there to like heart rein everything in and make everything very much researchy, and I wanted to chat and get excited about different things. Oh my gosh, I'm really interested in identity too, tell me more. So that was what was really exciting for me. But yeah, I think as well, having the constant feedback throughout, so even stuff like people for feedback on the poster that we'd made, and they were like, yes, the color palette, the graphics, the font, and every single step of the way we've been having feedback from young people to make sure that it is accessible, that people want to be able to absorb the content, and yeah, that's just been fantastic, from the feedback forms just to people emailing us. So that's been really important.
Thanks, Becky. We have got, Beth, you've put a sort of question, but I wondered if you want to, if you're willing to sort of come onto the mic, and perhaps we'll.
Beth's mic's not working, which is why she said sorry.
Oh,
she couldn't
hold on.
get in.
It is working now. Can
Oh,
you hear
yay,
me?
great.
Sorry,
Do speak
Beth.
up.
Hello. Yeah.
Excellent. Thank you. I wrote a bit of an essay in there. Sorry about that. It was one of the first things that you said, Nick, about service evaluation and it being that real seed for further questions and going forward. And I was just wondering if you had any advice about, or thoughts, because what we're finding now is that people are coming to us as they're hearing more about research going on in CAMHS in Cornwall. We've got people coming with those initial seeds that aren't ready for research questions yet, but they are just perfect for a service evaluation, and we don't really have the capacity to support them, and there isn't really a place where they properly sit at the minute in our trust, because they're outside of the other sort of teams. And obviously we don't want to say no, don't do this, but it'd be really nice to have the right governance and framework and approach to it. And I just wondered what other people did. Oh, obviously you have your Cray board.
Well,
thing.
I mean, with Beth, we're very much in the same situation as you, in that, and people come to us. Our quality improvement team have got a really nice flow chart of sort of decision making. You know, is it service evaluation? Is it QI? Is it research? And that's really, really helpful. And so we sort of direct people to that. But what's really clear is if it's research, we help and have a lot of guidance. If it's quality improvement, that the QI team can help, and obviously then the service help set that up and deliver it. But that with service evaluation, people are sort of a bit adrift, and I at the moment, like you say, the infrastructure that we have, there isn't a team that can support that. But maybe, and this is my view, it's completely my view, that actually we should think about using some of our research capacity funding in some way to go, right, can we hold people with service evaluation, and can we create a pathway that we help support them to talk to their clinical teams and do a service evaluation, and then as part of that we then can introduce them to the next possible steps, possible funding streams and things. You know, because I think it's a missed opportunity. I really do. And I think that people come with these exciting ideas for service evaluation and they feel lost. They don't know what to do. There's nobody to kind of hold them within that. And then perhaps they don't even do the service evaluation, let alone lead on to going, oh, actually, I think I found that we're doing something absolutely brilliant. Actually, this might be a research study, you know. So personally, and I've worked in research for a long time, but I've always felt that this is a real missed opportunity. So I don't know, maybe we need to have a little kind of mission to find a way to fund it in our trusts. And if you get to fund it first, let us all know, won't you?
I think one of the other reasons perhaps why we focused particularly on the clinical psychology trainees is because there's then a governance structure within the university that also oversees the quality of those service evaluations. But yeah, it would be amazing if the R&D department had more capacity to support with that. I think definitely you, Beth and Nick, should start a campaign.
Yeah, I'm definitely very enthusiastic for that. So we've got another question from Timothy from Cambridge. So what, when do you plan to make our evidence summaries available? So the evidence summaries are being disseminated to the people who've taken part in the project, and the plan at the moment is that we are so CAMHS sits under Child and Family Health Devon, and at the moment they are working on their website, and our intention is to have a space there that we can promote this project and enable people to continue to submit questions, and that we'll put the evidence summaries on there. We'll have what we're at the moment, that's sort of in process. So we're having discussions about whether we can have a host sort of site for it at the moment, and we'll have links, but we will be making them available. And from the Chime website and from DPT R&D site, we will have sort of hyperlinks to it. But I think so yeah, that's our plan. And I don't know what everyone else thinks, but I think if you're interested to read them, we'd be happy to share them as they come out with people that have attended this group. So I'm sort of slightly looking at Becky of a way that we can do that.
Yeah, let me know. We were intending on emailing out the slides to everyone after this presentation. I am more than happy if people are interested to include some of the evidence summaries that we have got that are ready to go. We have got 3 that are ready, and 2 that we are waiting on young person review. But then, yes, I'm more than happy to share. In fact, very keen to share. I think everyone should read them. I think they're great. Thank you so much to everyone that's been working on them.
We've just had another question as well, about this presentation being available. And again, we are intending for a link to the recording to be made available, but we need to go through our comms team to find out exactly where that will be placed. But if for everyone present, obviously that link then we can share with you, and then if you want to disseminate it to other colleagues, you're very welcome to do so.
Thanks. Has anyone got any more questions? You can either put your hand up or pop them in the taskbar. So first of all, really, you know, thank you all for actually asking us some questions. We have on our slide a couple of ideas, because sometimes there can be a kind of resounding silence when you ask for questions, but we've not had that, which has been fabulous. But I think some of the things that we wanted to reflect on were perhaps for Becky to talk and Gretchen to talk about the dynamic nature of the project. And also, well, these were sort of 3 topics that we thought that we could mention. So if there aren't any further questions, perhaps we can do that, and then we'll have our sort of final close up. So Becky and Gretchen.
Hold on, Gail's got her hand up.
Sorry, just one last more comment really. I was just wondering, I know in America there's like library studies students, like people who are studying to become librarians, and I'm sure there must be in this country too. I wonder, could they help with evidence synthesis? Because I know people have put in about medical students, but I wonder, would it be something that might, be nice for them to help with? Just an idea.
Yeah.
It's a bit random.
Well, we'll definitely note that down. Thank you.
Love that. Any idea? Random, not random, please bring them. Yeah, so I guess just for the last few minutes, some things that we were thinking about, something that was really striking for me, and I think Gretchen could attest to this as well, was the dynamic nature of this project. I mean, not only the workshops, which I talked about before, there's the vast difference between them, but also working out the methods for prioritization. We ended up having 3 different ways of prioritization, as Gretchen explained, and this had to change as we got more and more questions. As we had so many meetings trying to work out these processes and getting feedback as we went, like, oh no, this is too many, should we do it in the room, what are we going to do? I mean, Gretchen, what did you what thoughts did you have about that? Because for me it was wild.
We were just really just trying to make it as easy as possible, but also to give people the chance to feedback about as many, all of the questions, and kind of do it in a way that where the math all worked out and we could get a nice ranking, but also didn't overburden anyone or make anyone feel stressed or overwhelmed. So and I guess because we were doing it iteratively, it gave us a chance to try different methods and hear from different voices along the way as well. So but it's been really good. And I guess just to say, I guess we focused on Devon in terms of our feedback on that prioritization, but it could be something that'd be interesting to replicate elsewhere and hear what other people think, if they feel the same questions are as important as people in Devon do.
Yeah, definitely. And I guess the other thing I was thinking about with the dynamic nature is not just the young people and our methods of prioritization, but the fact that we were navigating multiple groups with multiple group leaders, and we were mindful that in this time, it is not an unusual thing to say that people are stretched. Everyone's time is precious. It was quite bizarre for me personally. I was reflecting on this because I was doing this one day a week. Other people have had like a couple of hours here and there throughout the week, trying to lock this down all into one day, and knowing that this isn't other people's priority. So on Tuesdays, this is like 100% my focus. Other people are trying to squeeze us in, thankfully letting us dip into their groups, utilize their time, being facilitators for us coming in, and that has proved quite difficult at times, but overwhelmingly, as we've said, it's been worth it by being able to talk to such a wide range of people. And again, I don't know if Gretchen, you have anything to add to that.
Yeah, I think it was really important that we went to existing groups. So sometimes they were young people who had been involved in research or in participation in CAMHS, but a lot of the people that we met with hadn't done anything like that before. But that was really important because it meant that we got these new voices. But we also had to be mindful that these groups were meeting regularly for their own reasons and to meet their own needs. And so, we needed to make sure that, we acknowledged their time, obviously, but also that we didn't take up more, that we didn't take up too much of their time, we didn't ask too much of them, and that we, and so some of that meant that it took us a long time to find a date that we could meet with them, because we had to fit in and make sure that they had weeks where they were planning to do fun things or interesting things or important things for their own well-being, and we didn't want, we had to fit in around that. So that was a challenge, but it was important, and it meant that we got to hear some great new voices on this project.
So if I can just do just a couple of reflections on the sort of dynamic nature of the project, I think, next time I would always try and have a longer time frame to do the original project, because it has changed and flexed. I think also thinking about, I think one of the things that we've realised over time is about reflecting on us being sort of protective of the project, because we were and trying to keep it to the original remit, because I think that there's been a lot of enthusiasm, and you know, with that you can kind of, your ideas can snowball, and actually bringing it back in and going, right, what is our plan, and trying to stick to that, but then knowing when it's kind of reasonable to share. So I think we were approached about a group who were looking at research into self-harm, or beginning to think about possible research into self-harm, and actually it was really good to be able to share, well, you know, these are the questions that have been kind of raised by young people, and actually it's perfectly reasonable to share those, you know, because the wording is going to be different and nuanced, and I think that, yeah, we've, like I say, we've had to sort of reflect and go, what do we share that it is important that we keep it related to CAMHS? So the groups that we went to were CAMHS group, and not other groups of young people that haven't utilised the CAMHS services, but actually that it is good to share what we've gathered, and that voice that we've gathered. So we've got just a couple more minutes. Has anybody got any more questions, or any of our lovely CAMHS team want to say anything else? No. So
Hannah, do if you've got a question.
Oh, thanks. It's not really a question. I just feel like I can't get to the end of your session without commenting on what a remarkable piece of work I find it to be. I just think it really speaks to just a fantastic process of collaboration, both across agencies, with young people, with clinicians. It's just remarkable to bring research to life in such a kind of attuned way to young people. I think it's such a great piece of work, and thank you very much.
Thank you very much, Hannah. It's so nice to hear. We have all really enjoyed it, but it has been a lot of work. And it's really
even
lovely.
better if you've enjoyed it. That's fantastic. Yeah. My only other query was whether, in terms of CFHD, thinking about some of the work that's going on in the website, Lisa, this may already be attended to, and I just don't know, but there's probably a space that we can accommodate that on the website and make it really available for young people. Yeah,
that's the plan, Hannah. Yeah.
Thank you.
We're excited about the new website development, because I think that'll work really well with the graphics and yeah, the way that Becky's designed things with this project.
So our final slides are really just some links to places where you can get a bit more information. So, as I say, the initial innovation funding bid came from the CRN SWP. Most CRNs around there's 15 around the country. They tend to put a call out April, May time for innovation bids. So it's well worth getting your thinking cap on now. Maybe approach your CRN and see if you can find out the spec for their innovation bids. It doesn't change enormously, and they can also provide you with a sort of scoring mechanism that they use. So, you know, I would say to you, if you've got any ideas for innovation, get them down now, get planning, because the window's normally quite small to put the bids in, a couple of weeks. So be prepared, and you can put in quite a few. And then we've got the CRN newsletter. So this was, we sort of did a poster as an output from the project. So you can see that 2-page poster, and then links to our websites that hopefully will be, you know, putting links in around this project in due course. And if you wanted to feedback to us, the final slide just gives you some details of the CAMHS research, audit and evaluation website, so you can feed into that. So we're going to wind up on time. thank you very much for everyone, for Rachel, Lisa, Becky and Gretchen for doing the project. Thank you for the CRN for funding it to start with, and Rachel again for PennArc for continuing the funding, so we can kind of really see it off and hand it over to CAMHS, you know, fully formed and sustainable. And thank you all very, very much for joining us today. It's been really nice to see you. Bye-bye.